Hey everybody, it's Liz with Artisan Physical Therapy. I want to talk about the core today and how that relates to back health and back pain. Primarily, I want to teach you something that's really helpful in terms of how to strengthen this area appropriately. We're going to strengthen a muscle that's little known in the general population called the transverse abdominus. It attaches from your pelvis, your ribs, the ligament in the front when you think of your six-pack muscle, and then all the way around into your spine. And when it works, it holds everything in like a back brace. So in order to have a healthy back, that needs to be working well and activating, and oftentimes it's not when people have back pain, either before or after. So this is a forever exercise, meaning you should be doing something like this, either harder as you get stronger, depending on your fitness and your health, or easier in times where you're not as conditioned or not as strong or healthy. Okay, so you're going to lie on your back, and then you want to find a neutral position just by tilting your spine to that comfortable position in the middle. So once in this position, you'll tip your pelvis back and forth until you find that comfortable spot in the middle, and there should be a little bit of curve there, not excessive, and you shouldn't be pressing totally flat. And then you're going to tighten, just draw in your belly button to your spine, or you can think of stopping the flow of urine, kind of tightening your pelvic floor. And then for a lot of people that activates your transverse abdominus, and you can just put your hand over your lower abdomen here and just feel with your pinky if you feel that tense up, and everything should tense, but it shouldn't bulge out. Okay, so this should be pulling and flatter. So this exercise, when practiced, will give you a nice toned stomach and a flatter stomach instead of a stronger, bulgier stomach. So you'll have a flatter stomach. So you draw in and you hold, and then you lift one leg, and then you lift the other. You lift one leg and the other. You don't hold your breath. So you tighten lightly at first, and then the harder it is for you, you need to tighten more strongly, and you need to make sure that your back's not moving. So a lot of times what will happen is you'll lift up one leg. If I don't tighten here, my opposite side's lifting up. Or this one, now my right side's lifting up. So I need to make sure my spine's not rotating, because again, all I'm trying to do is move my legs here. My back shouldn't move, so we need to teach it to be stable. Another thing to look out for is arching of the back, and this happens a lot very subtly as people lift up, that they arch and this space becomes bigger. So what your abdominal muscles do, just think of a sit-up, they crunch and they make this distance shorter. You need to make sure that distance is not growing bigger in between your ribs and your pelvis. So as you lift up, that stays the same. And then of course these can become harder and can become a lot of the things that happen in fitness classes or in the gym, but you really need to make sure that this is strong and core. So here at Artisan Physical Therapy, we can teach you more. We can teach you how to make it harder, how to make it easier, give you feedback, but it's very important that your back's not getting overstressed by having a very strong transverse abdominus and a lot of endurance in that muscle, so it can go all day for what you want to do and protect your back. The other thing is that it needs to work right. The timing needs to be right. So your brain talking to your muscles so things aren't moving too well. So anyway, we just call this the march. Just up and down. You can go for a minute at a time, or you can do 10 on each side, so that's 20 totally alternating. Make sure that your breath is staying regular. You're still breathing and you're not running out of air as you do it, but just breathing nice and normal so you're not stabilizing this region with your diaphragm, which happens a lot. If you have more questions, please let me know. I'd love to create content that is helpful to you, the questions that you have. Thanks for watching this video. Don't miss out on any of our video content by subscribing to our channel. You can learn more about our practice at www.artisanphysicaltherapy.com, including joining the blog. We're at Facebook and Instagram at @ArtisanPhysical. Let's get to the source, and together, let's get moving.